Hi guys, welcome back to my channel Navjottalks. This is Registered Nurse Navjot and I welcome you all to my this small channel which is growing slowly and slowly. I'm really thankful to all of you for supporting me always, because this is a channel which I made in order to help you guys, international people, international students, to pursue their nursing career in Canada. If you're looking for my Instagram page, it's Navjottalks. In this video, I'm going to help you to make a timetable for your Nclex exam. So people, those who have got eligibility to write their Nclex RN exam, very congratulations to all of you. You are soon going to be nurses in Canada. And if you haven't got the eligibility and you applied for Nclex in America or Australia, you can get one eligibility, of course, and then you can appear for your Nclex exam very soon. So all the very best to all of you. So if you are just wondering like from where you should start preparing for your Nclex exam, this video is for you. Those who haven't subscribed to my channel, I request all of you to subscribe to my channel. And if you really like my work, please don't forget to like and share with all your friends or people who are like you and those who want to have some help, because sharing is caring. So if you are going to do the Saunders, which I did for my Nclex exam, it was really beneficial for me. This was the only book which I referred to for my Nclex exam. Saunders is a great book, the Canadian version, but I don't know if you're going for the America exam or Nclex is actually the same, but the two versions of this book, Saunders, one is the just the Saunders comprehensive, one is the Canadian comprehensive. So I followed the Canadian comprehensive because the Nclex which I gave was the Canadian. I mean, I went through the Canadian process only, and I got the eligibility from the CNO to write my Nclex exam. So I referred only for the Canadian comprehensive because this was a book which I got in 2018, and I had this book from quite a while, but I didn't really pay attention to this book from some time because I didn't have the eligibility to write my Nclex exam. But when I got the eligibility, this was the only book which was like my this was the only book which I could do, because I really had only 8 to 9 days to study for the Nclex. Sometimes you have so many books, Mosby, Kaplan. I actually had all those books, Mosby, Kaplan, that. So I had almost all kind of books, e-books, but I didn't have time to read all of them. But now I can say I referred only Saunders, and it was a great decision which I made. Because having all the books doesn't make a difference, but if you have one book which is a good book and you have time to study that book and you are following actually everything which is written in that book, you're good to go for your Nclex exam. But my plan was, I studied system wise. I did respiratory system, and then I did all the questions related to respiratory system. Then I did cardiology, I did all the systems, and then I did some random questions. Like, this is my book, I open any random page and whatever question is there, I just try to do that. I really didn't see what system was that from, but I just wanted to know, because in Nclex they're not going to tell you that it is from cardiology or respiratory or GI. So randomly I started doing some questions. These are the books which are helping you to prepare for your Nclex. So they are not going to be easy, so they are not going to give you simple questions. But in Nclex it's not always difficult questions, because it's a computerized based exam. So you get one difficult question. If you pass that difficult question, they're gonna give you another difficult question. But if you fail, I mean if you not pass that question, if you're wrong on that part, and then they will bring you one step down, which is going to be an easy question. And if even you don't do that one, they will bring you more down. And then there's a threshold which you have to meet in order to pass the exam. You have to stay above the threshold line. So if you're just below that line, it means you're fail. If you're just above that line, and it means you're pass. Sometimes the computer shuts off at 75 questions. Sometimes it takes you further, and then you have all 145 questions. In my case, it was 145 questions, and honestly I didn't have any idea how many questions are totally in Nclex exam, because I really didn't pay attention to all that, because I had only 8-9 days. So all my focus was on just the content and the questions. And one more thing, if you don't have a lot of time to study line to line in Saunders, you can actually start from the questions. Like, just start doing some questions from the respiratory system. In that way, if you fail the question or if you pass the question, but you have a rationale explained for that specific question, in that way, you always have something in your hand or in your brain. So if they ever twist a question or if they put a question in a different way, but you know the rational also, I would say, if you pass a question, don't skip the rational, because you still need to know if your answer was correct because of the same reason which they are giving, or if it's a different reason, because sometimes it's just because your answer is correct, you don't really pay attention to why it was correct or why it was not correct. Sometimes the reason is totally something which we don't expect, or if or something which we don't know if this could be one reason for this question or this option. So when I was doing my questions, those questions which were incorrect, I really paid attention to the rationale. I marked all the questions. I did not do all the questions from the Saunders. This question word is a lot many times coming, but this is actually, we're talking about the questions here. So whatever was wrong, I marked it, and then 2-3 days before my exam, I actually paid attention to all those incorrect questions, and then I read the rationale again. In that way, I was clear. If something comes from that topic, I know this could be this thing. But even if my answer was correct, I just did not leave the question without reading the rationale. I would suggest go system wise, because in system wise, it helps you to be organized in making notes. Those who have 3-4 months, or do you have weeks, even like 4-5 weeks, you can spend 2-3 days on one system. There are hardly 8-9 systems, or like 8-9 chapters which you really have to focus on. Everything else is just the same story, just twisted around. Respiratory, cardiology, GI, neuro, musculoskeleton, reproduction, and mental. And then maternal and pediatrics. It is very important. It's not that Nclex don't ask anything from those two, but it's you just wanna give one look on the whole stuff from the maternal health and the pediatrics. If you know the adults thing like by heart, you know everything, every lab value and everything for the adults from all the system. Pediatrics is easy. So the problem is when you start doing randomly, like you do 2 topics for pediatrics, 2 from here, it's all confusion. So first do for adults, and then you will see a little bit of variation in terms of pediatrics. But it's easy because now you have the idea of adults, then it's easy for you to remember for the pediatrics. So I would say pediatrics is something which you should do at last. And maternal is important. Maternal is because maternal is not a very vast topic, but I would suggest you to give at least 4-5 days to maternal health or maternal nursing, whatever you call it, for the Nclex. Mental health is very important too. Suggest you guys to do system wise and then do some questions. How many questions you should do to pass Nclex? Like practice. If you only have 10 days, like I only had 8-9 days, I did around 1200 questions. So this was something which I did. So you should do about 120 to 150 questions per day, which initially seems like, oh, only 100 questions, but when you actually start doing questions, one question takes about 5 minutes if you want to really read every line of the like the question, and then all the options and every rationale for the incorrect and for the correct. So 120 to 150 question would be sufficient, because in that way in 10 days you can do 1200 questions, and then you can start all over again. Like I don't know how many questions are there in Saunders, but I would suggest if you have time, just do 120 questions system wise. Though it seems like 100 questions, oh, I can do it, but no. When you actually have to read every option and why it's wrong or why it's right, like you actually read all the rationals behind your options, then it takes time, like 5 to 6 minutes easily on one question. So 50, I would say, just start with 50. Once you have that pace, and then you know that you have a nice timetable, and then things are getting settled in your mind and it's easy, now you're used to studying for Nclex, slowly and slowly maybe you can increase your questions capacity. When you are already into studying for Nclex for about a week or two, then if you are doing respiratory, maybe you'd find it difficult initially, but when the next time you're doing cardiology, maybe you found something in the respiratory system which is also connected with the question in cardiology, so it seems easy. So what I noticed is your capacity to do the questions increases as you do systems, because some of the diseases, they're so interrelated. Then you know one disease and then you know the other disease, like you will find the same type of question getting repeated in all the systems. So in that way, there are a lot of topics and there are a lot of questions which is getting repeated, like not the same disease, not the same sign and symptoms, not the exact same thing, but the concept is the same. So slowly and slowly you will get used to the questions. And also very first day you don't have any idea, and then on the 10th day you have a lot of idea, and maybe you have the whole full idea of what's going on, like what is actually Nclex and how they're gonna ask you the questions, how they're gonna twist you, and what's the pattern which they're going to follow. And also set a questions, like select all that apply. Some people find it really difficult, but I told you I had like more than 90 questions were like set. I didn't count actually, but like I know more than 50% of my questions were SETA, and I was like, okay, maybe I'm passing my exam, because SETA is a difficult question type, and because you don't know how many are correct and which one are correct, and you have to decide like how many could be correct. If you miss one correct option and you select all the other correct options, you still don't pass that particular question, because they want you to select all that apply. Some people also have habit of just making note of everything, like even when I was in my college, so if I am doing respiratory, I would just read one line to line from my book, and they say, oh, this is important. Everything seems to be important, because everything in the book is important, right? There's nothing which is not important written in the book. But I would say not make notes of everything which is important. The thing which you're missing, like a question which is getting wrong over and over again, just make a note, because one time when your fingers write something, it fits more in your brain. This is something which works for me. So start making a notes for the wrong questions which is getting wrong again and again. So just make notes of that. And rational, like why is this thing not correct, or why you are getting wrong on that part again and again. Just make a note of that, so that on the last day you just have to revise whatever you have written in your book is easy for you. So this is something which I just wanted to discuss with you in this video. We'll see you in next video. Till then, take care. Bye.